This is still Midday Live on TV3, and I would want to focus on Ghana's health sector with specific reference to the National Health Insurance Authority. And we hear that the scheme managers are asking that they would need a lot more levies, or we would have to pay just a little more so they can manage the scheme better, and also going forward how best they can sustain it. I've been joined in studio by the communications manager of the National Health Insurance Authority, Selom Adonu, to throw some more light and then give us reasons why they think that this particular levy they are calling for is justified. Thank you very much for joining us, Mr. Adonu. Now, first of all, is it true that the National Health Insurance Authority, or the scheme, is asking for an increment in the levies we pay?
Well, thank you very much, Martin, and a very good afternoon to your viewers. It is not the NHIA per se. I mean, we've said it a number of times, but it's coming from a stakeholder meeting held on Thursday and Friday, and amongst other things, the stakeholders felt that the NHIS, requires more resources to continue to do the job it's doing. And the NHIS, as we've always said, has come to stay. And if you look at when it was established between 2003 and real operations beginning in 2005, where we had about 1.3 million people on the scheme. And I mean, fast forward 10 years now, we have about 10.1 million people on the scheme. It's only fair that stakeholders should say that, looking at the astronomical growth in membership of the NHIS, more resources should be assigned the scheme, so the scheme will continue to do what is mandated to do by law. So yes, stakeholders have made that call that government should increase resources to the scheme. They made a number of suggestions. They said that the 2.5% levy, which currently accrues to the NHIS through government, should possibly be increased maybe to 4%. They also suggested to government that about 25% from the communication service tax be assigned the National Health Insurance Scheme. A number of suggestions were also made. For example, others talked about the fact that we introduce sin taxes, or we slap some levies on alcohol products and cigarettes, because when you smoke or you drink and you fall sick, you resort to the National Health Insurance Scheme. So there should be a way of keeping the scheme running. So this stakeholder engagement we've done is not the first. It's not the first of its kind. It is a very permanent feature of the National Health Insurance Scheme. Our attempt to open up the operations of the scheme to stakeholders and to the public at large. So we see where we've come from, where we are, and where we are going, as we try to address the challenges which have characterized each stage of our growth. So yes, I mean, it's a discussion we had, and that was one of many points raised by stakeholders.
Okay. Now, we have also been told, well, like you said, it's an issue that came up during the discussion. Now, can you tell us how much you are expected to ask for, and can you juxtapose that to the delivery of services by the National Health Insurance Scheme? Would you say is justifiable?
Of course. I mean, we have a very generous benefit package to start with. Benefit package, by definition, simply is a basket of conditions that the National Health Insurance Scheme offers. So, for example, if you have maybe malaria per se, or for example, you go to the hospital, once malaria is covered by the NHIS, or once it is in the benefit package, it means that malaria is covered by the NHIA or NHIS, and so you have medication, you have care and everything which has to be the treatment of that conditions under the NHIA. So we have a very generous benefit package which covers about 95% of all reported disease conditions in the country, and that is a very generous benefit package to begin with. Some of the stakeholders at the program, for example, said that the benefit package should be reviewed, and indeed the call for the review of the benefit package has been ongoing. And we heard from one of the ministers of finance who was there at the implementation of the scheme, and he said that when the benefit package was drawn around 2003, there was the ILO, for example, said that the benefit package was good for the time, but after 10 years it had to be changed because things would change. The disease patterns of the country may change after 10 years, and the burden of disease generally of the country is shifting, from maybe communicable diseases to lifestyle diseases. So an institution like the NHIA or NHIS should have a benefit package which is responsive and is ready to respond to the healthcare needs of the people. So that review process, will kick-start very soon, and we will ensure that every condition which is covered there, has something to do with the needs of the people directly. And you also asked the question comparing our demand for resources to what people get. Yes, go around the country, go to any facility today. About 90% of the people at the OPD of that facility are members of the National Health Insurance Scheme. Right. So if the scheme wasn't working, you wouldn't find such an overwhelming number of people having the cards. And the fact that we are doing the biometric registration exercises, across the country, or in four regions of the country actually, and the crowd which is coming with it is evidence of the fact that people really are on the scheme. When you go to other parts of the country, the only thing they know works is the National Health Insurance Scheme card. Okay. That is not to say that we don't have challenges. Yes, we do, just like any institution has.
And finally, before you go, the issue of sustainability for the scheme and the amount you need to run a smooth system. Do you think that the levies you're asking for can help in that direction, or you would want more? And what are the major challenges that are bottlenecks for the scheme?
Well, sustainability, this is a social protection program. Sustainability, or every social protection program, has sustainability as an issue. The base, ground zero. Every social protection program has a sustainability matter to grapple with. And sustainability is not left in perpetuity. Sustainability must be defined for specific periods. So, for example, we are giving you X amount of money. That money will be able to take you, or will last you the next 5 years. Okay. So, in that context, sustainability has been defined for the next 5 years. So, if you enter the 6th year and that source of funding is not increased or replaced, you'll be running into trouble. Right. When the scheme started, we've had 2.5% levy, the NHIA, coming from goods and services. Of course, is the truth that once the economy expands, money accruing from the 2.5% also, grows in volume. That's fine. But the problem we have had is that the NHIS has grown faster than the economy. About 1.3 people in 2003, 2005 to 10.1 million people in 2013, and that is significant. So if what NHIS does outgrows what the funds is, you realize that you have a little problem there. So we are saying that in order to expand or extend the sustainability period of the National Health Insurance Scheme, we must rethink our funding regime. The tax element must be increased. We think that other sources of funding must come in, amongst other things. And also, there is this thing we call the exemption regime. Okay. About 70% of the people on the scheme today do not pay premiums. Talking about people below the age of 18, people above age 70, SNP contributors, SNP pensioners and all. We are saying that for equity to prevail, it is not every under 18-year-old who is poor, so can enjoy it for free. Some can pay. Right. So let's make those who can pay, and those who cannot pay, take it for free. Okay.
We would have to leave it here for now. Thank you very much. Selo Madonu is the Communications Manager of the National Health Insurance Authority, for throwing some more light on the story that broke yesterday, that the authority is asking, or the scheme needs extra funding or some other sources of funding.